Yeah, programmatically and disease itself, there is I mean, not much disease itself. There is not much of relation, not yet proved. Uh, See, diagnosis of TB came down drastically because of COVID-19. So fear of getting COVID-19, if the patient is visiting the hospital was there, so patients were not coming even though they have cough. Resources and manpower from TB got diverted to COVID work. So many of the TB workers, they started working for the COVID. So TB work suffered. And frequent lockdowns. Transport was not there. If the patient is suffering from TB, they are not visiting hospital, they could not visit. So this was a major impact on TB program. It has gone back from 5 to 10 years. So another important thing is cough was there, which is both common to COVID as well as TB. So people used to get confused. And if the patient is suffering from cough, they are not interested to come to the hospital because they may get isolated. So 15 days they are not there in the house. So this fear was there in all the population. They are not coming. So they kept on coughing and they kept on spreading the disease to all others in the family as well as in the society. This was a major problem. And that is the reason in the initial phase itself, Government of India issued a circular. If the patient is coming for diagnosis of TB, they have to be checking for COVID also. And those who are coming for COVID diagnosis, they should also be given sputum for TB checking. This circular was there in the initial part of the pandemic itself. So, so these things to some extent happened, and we could do some justice, but TB suffered a lot. Many of the TB patients, they could not come, they were not diagnosed, so they died because of this problem. The Is there any possibility of interaction between the TB and COVID? So far, no evidence. The only thing that is, some curiosity is the extrapulmonary type of TB is increasing. So extrapulmonary TB, when it is increasing, uh, what is the reason? We don't know. Normally, we expect around 15 to 20% maximum. Most of the times, we have seen 18% around extrapulmonary TB as compared to the pulmonary TB. Now it started increasing. So wherever there is more COVID, more extrapulmonary TB cases. So so these are all things which are fodder for the future research. So far direct evidence is not there that there is a direct relation between these two diseases. So these are to be investigated further.